My name is Michele Ellicks. I'm the Community Outreach Coordinator for the Registry of Motor Vehicles. I present workshops across Massachusetts, primarily for older road users, older drivers. During workshops and even after, many drivers come up and express their concern about a family member or a friend. They may be attending the registry's workshop not only for themselves to gain knowledge and safe driving tips and to understand all that's involved in being a licensed driver, but they're also gathering information for themselves to help others, to help a family member, to maybe help a neighbor assess or determine whether or not they are safe to drive. I recommend that if you are concerned about an older driver and their ability to drive, it's very important for a family member or friend to observe the older driver driving, to observe, are there near misses? Observe how they are driving, how they are able to navigate intersections. Once you're at a destination or a safe location, or bring up your concerns, but come to that conversation with respect and with understanding and with solutions. The conversation with an older driver about giving up the keys will go much more smoothly if you go armed with options and come to that conversation understanding what the needs are of that older driver.
I'm Vanya Jones. I'm an associate professor at the Johns Hopkins Bloomberg School of Public Health. I am also the assistant dean for community engaged research. We underestimate the importance of what it means to give feedback, especially to anyone that we're riding in a car with, about maybe changes we've seen in their driving. Now, that can be risky because it is a relational thing, right? So if you're a child and you're going to tell your parent, did you see how close you get to that? That could start an argument. But there are ways, there are programs out there that help us talk to our family members about driving behavior. You can also talk about the car itself, right? So if you're a family member of someone and you see dents and dings, it's one of the things in my research that we examine cars of older adult drivers. And when you start to see more in areas where you know there are blind spots, low down on the bumper, on the side of the car in the back towards the passengers, you can start to see more dents and dings on the car. Those are good conversation starters. How did this happen? Do you remember when it happened? Do you know when it happened? And those sorts of things, not as an interrogation thing, but understanding that cars themselves are important and stay, maintained. The more dents you get in them, the more you can start to see someone maybe having problems seeing or responding fast. If you don't have a relationship where you can talk about these things and they come across as supportive and helpful, you actually can cause a lot of relational harm, and that's not what we want to do. Driving, like other sources of transportation, are a community-based thing. And so sometimes the message that someone needs to consider not driving anymore or giving up the keys might be better heard from a different support person who they see as being really helpful or supportive in other ways. So a good friend, it might be a spouse, it might be a grandchild, it might not be the child. There could be a strong relationship with someone else in the family. What's really important is that we know the right person to have that message. It also might not be a family member. It could be a clergy member if they're really active in their church or their synagogue or other places. It could be your physician. Primary care providers are people who can provide guidance around health and all types of, sort of health issues. It's interesting, one of the most respected groups for giving advice on all types of life things they have absolutely no expertise in, are healthcare providers. People look to their doctor for all kinds of things, and even physicians will say, I don't really know about this, but someone finds me as someone who's a credible messenger, so I'm going to share, sort of my opinions and lead them to the right path. That is very true for driving. In fact, there's more and more training for physicians around driving and driving behavior than there has been ever, as we have, driving licensures across this country.
Working in my 20 years with the Registry of Motor Vehicles, doing the work that I'm doing with older driver safety, I have seen situations across the state. In one situation, the person developed dementia And as the disease progressed, her neurologist specifically told her, do not drive. But yet she continued to drive. The family members, her sisters, lived in the community, and they all really found it a great challenge to get their sister to stop driving. Finally, the family turned to a trusted friend who also happened to be the retired chief of police in that town. And they asked the retired chief of police to please talk to her, to talk to their sister about giving up the keys. So the friend did. They knocked on the door. They encouraged and convinced her to stop driving. And it was quite interesting because she readily agreed with this person who she trusted. She trusted what he had to say. And her only request was that the family not sell her car. She, in her situation, needed to see her own vehicle in her driveway, even though she agreed to never drive again, and the family agreed to help provide rides and provide transportation for her. In one community, a rabbi of a synagogue actually wrote a letter to a driver who would not give up the keys and had every member in the synagogue sign it. The letter said, "We love you, we care about you, and we also care about the safety of every member in our community. Please stop driving." That is what convinced this person to stop driving and to give up the keys. So it's different for every person. There's not one channel that a person should follow. And if you see something, say something. But if the driver is not willing to listen to you, find the person to whom they will listen. It may come from a financial advisor. It costs $15,000 at least to own and operate a motor vehicle. The driving retirement conversation may come from a family attorney, because in Massachusetts, all the responsibility of maintaining driver safety does fall on the license holder. So there can be liability in situations if a driver causes a collision and causes damages or injury or even death. So a family attorney may come in handy with also talking to an older driver about their driver safety. There are so many resources available. Even the registry's website, mass.gov/RMV, has an older driver page where we list resources not only for older road users, older drivers, but also for family members, caregivers, providers who might have concerns about the safety of an older driver.